Excellent. And ladies, same true in your organizations?
Right. We have a grant through Robert Wood Johnson Foundation, and we're certified application counselors, and they go through the same HIPAA compliances and training, and their licenses are with them. But the most important thing I think that I've heard is that people have been approached by insurance companies, and they believe that they're getting information that's very impartial. And we don't guide people to a specific plan, our staff don't. It's just educating them about what they qualify for. And so that's very important to know, that we don't keep information and that we're very impartial, and that we just educate them about what qualified health plan is available for them.
And there are a lot more certified application counselors because there are not enough navigators to, of course, reach everyone in Broward County. So with this grant, I know Broward Regional Health Planning Council was able to subcontract with different organizations that happen to already be access sites through DCF. So the community is already trusting those organizations, such as Community Access Center, because we do the Medicaid food stamp application. So now they're all coming back to apply for the Affordable Care Act as well. So they were able to partner with the different organizations that are trusted organizations in those respective communities as well.
Excellent.
And you're able to access, to find out who are those financial assisters. You can go to each of our websites. If you went to mygetcoveredamerica.org, there is a sister there's a sister tool where you can input your zip code, and it'll provide you with the closest consumer assisters that are available to assist you in that community and in your neighborhood. And if you went to each of our websites as well, it's sort of the same thing. There are ways to access that information. The 211 phone line is very important for that as well. And healthcare.gov, going to the actual website where the marketplace exists, there is your ability to find those assisters in your community is there as well.
So that's something I really think I'd be remiss if I didn't bring up. There were problems with healthcare.gov. They lasted a lot longer than I'm sure anybody would have liked. Well, there are some people who were happy about it. But let's say if you really wanted to get insurance, you would not be happy with the fact that it wasn't working at the beginning. What's the difference between the website, healthcare.gov, and the Affordable Care Act?
Nothing.
Well, yes.
Healthcare.gov is
an implementation of an act. The Affordable Care Act said we're going to make available to you insurance, and healthcare.gov is a mechanism to use to find that insurance, right?
Healthcare.gov is one of the different routes somebody can go to find out what coverage options are available to them that are provided under the Affordable Care Act. And it's just like they have a 1-800 phone number as well. And then the consumer assisters like these organizations that are in the community right now. Those three different routes are the different ways someone can go and learn about the plans that are available to them.
And they can also use their private insurance broker, or no? Can they?
Yes, they can. They can go to brokers as well.
Okay. And the insurance that they get once they go through this, I know there's all different kinds of insurance. Certainly if they wind up on Medicaid, they're on government insurance. But other than that, what kinds of plan, see if I can phrase it, if they sign up for a plan through Aetna or Humana, is the government involved at all?
The government could potentially be involved, yes, if that person qualifies for an advanced premium tax credit, which allows them to pay down the cost of the monthly premium. The advanced premium tax credit is not a sum of money that is given directly to the consumer. It's paid directly to the insurance company, which effectively makes the consumer's premium payment that much less per month. And then there is also something called cost-sharing reductions that they might qualify for, which allows them to also pay down not just the cost of the premium payments, but also the out-of-pocket costs, like the deductibles, like the co-pays, like the co-insurance.
And does the government have anything to say about what, besides we talked earlier about you must get your preventive care covered, you must have the emergency room covered. If I went through the marketplace and bought my insurance through Humana and I break my arm and I go to the emergency room, can the government say don't x-ray her arm or don't set it or don't treat that heart. We don't think she really has a heart attack.
Not at all.
No,
don't
they
provide
can't
that
do that.
care.
No, and that is not their function at all. As far as regulation of how this is supposed to work, that is not one of the things that they regulate. Each plan specifically states before you buy what kinds of things it will cover and what kinds of things it won't cover. And so if you have any doubts about those specific kinds of questions, I would suggest that you thoroughly, preferably with the assistance of a consumer assister or a navigator, look through each plan's details to make sure that it meets your specific needs, because it'll say if breaking your arm is something that'll actually be covered or not. Though I've never seen a plan that said that specifically breaking the arm is something that won't be
that
covered.
was probably a bad example, but you hear the government's going to get into my health care and tell me what I can and can't do or can and can't get. But aside, I guess what I was trying to get at was, aside from the premium payment, the relationship that you have with the insurance company and what they will or will not cover is with a private insurance company.
Yes.
There's a lot of things I fight with my insurance company about all the time. Today, I have no government intervention in my insurance plan, but I went to the wrong person or I didn't go to the right lab, and now they don't want to cover it, and you have to, fight.
In my experience, everything that the Affordable Care Act has done has actually done the opposite. Okay, it's never really limited anybody from getting any kind of coverage. If anything, it's expanded the kinds of things you can get coverage for. The pre-existing conditions is a very good example.
Big part of it.
Because previously, insurance companies, without the help of the government, were readily and happily limiting people's access to coverage based on pre-existing conditions. And it wasn't until the federal government passed the Affordable Care Act that now those individuals have the opportunity to get coverage, whereas they wouldn't have been able to before. And we see that happen in all kinds of small little places throughout the Affordable Care Act as well.
And a lot of what the certified application counselors will do is they will make a call to a doctor's office and they'll look at different medications people are taking, and they will actually find out if it's on that formulary. So if they do due diligence, they will find that out before they help them enroll them into that plan.
Oh, that's a really good point.
It's very important. And sometimes sessions can go anywhere, would you say, from 30 minutes to 2 hours, depending on the different health issues and how many times they've been to a doctor and what their needs are. And so our role is to really make those calls and make sure that that's covered.
Magaly, what do people have to be sure and bring with them if they come to a session?
Well, they do have to have an email account, because that's the way that the plan communicates with them. They also have to have a social security number for everybody that's eligible to enroll. And they have to really bring all their income information as well. And also immigration papers, if they're a U.S. citizen or the green card, they need to have that number input. Or an ITIN. ITIN is a identifying number for them just to do the tax returns. If they do not have a social security number. So those are the main information. That's the main information they need to bring with them.
I would also add any information about an employer, is essential to have if you are currently employed, especially if that employer also offers a certain kind of insurance plan to their employees. Because one of the things that happens is that if for whatever reason you have insurance offered to you through your employer, in order for you to have the ability to actually select a plan off the marketplace, the amount that you're contributing or that you'd have to contribute to that employer-based coverage would have to be more than 9.5% of your income. So as an example, if let's say your income per month is $1,000, and the amount that you're paying for your employer-based coverage, your contribution, not including the employer's contribution, is more than $95, then you have the option to then switch from that employer-based coverage to a plan in the marketplace. If it's below $95, unfortunately, the marketplace is going to tell you that you have to stay with your employer-based coverage.
What about if there's a married couple, and one has insurance available through their employer and has the option to do family coverage, but may or may not select that? What about the spouse?
The calculation is based on the household income, and so it has to be more than 9.5% of the household income for that family or for any individual in that family to move to a plan in the marketplace. So more often the scenario is The person who's directly employed by that company, they will prefer to stay with that company because the employer's contributions are helping to pay down the price of their premiums that much more. But then for them to add their spouse, it makes it insurmountably expensive, okay, for them to maintain their spouse on the same employer coverage. So the spouse is usually looking for different options in the marketplace, and they usually have the ability to do that because if they were to start getting coverage through their employer's plan, it would be well beyond 9.5%. Well beyond.
That's most of our success stories are people that could not afford the family plan through their employers, and now the spouse and the children are covered at a much less expensive option than if they joined their spouse's employer's insurance.
Cindy, this brings up a pretty good point. A part of the marketplace is the ability to, dependent on your income, receive financial assistance. Adrian was talking a little bit about tax credits, and what that really means is, if you go in and you put in your income related to what your income is, you and your family's income, you're going to be able to, it's going to be able to determine whether or not you receive a financial assistance in the form of a tax credit. That tax credit really happens right then and there when you're going to purchase your plan. It's going to reduce the cost of your monthly premiums. In Florida, we've had 300,000 people enroll up to this point. And 88% of those folks who've enrolled have taken advantage and have received financial assistance. So it's a big part of the marketplace, and it is a great place to. That's why you get to go and should explore it.
And that is a great place to end. That is the perfect story to end on. So if you need insurance, please call 211. Go to healthcare.gov. Do what you have to do and get enrolled. I want to thank Nicholas Duran, Magaly Prezeau, Adrian Madriz, and Lisa Agate for helping us navigate through the changes brought about by the Affordable Care Act. I've been your host, Cindy Ehrenberg-Seltzer, President and CEO of the Children's Services Council of Broward County, where our mission is to empower Broward's children to become responsible, productive adults, capable of realizing their full potential, their hopes, and their dreams. For copies of this program or any other episode of Future First, please call the Children's Services Council at 954-377-1000 or visit www.cscbroward.org. Like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children.